The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum, listeners and viewers. Welcome to another educating edition of the Health and Fitness Show. I am your host for today, Suliman Rafiq, and this program is broadcasting live from the studios of Inspire FM. Live today on Thursday, the 14th of March 2019 at 6 p.m, casting its positive vibes to all the lovely people in Luton and surrounding areas, with our positive airways also reaching listeners via the Inspire FM website. You can also view us via Facebook, so all you have to do is go to Inspire FM Facebook page and click on our live link. If you are listening to this show on Sunday or any other Thursday, then it is a repeat. Just before I get into the details of today's show, I request from listeners to please make dua for the passing of the mother of Fahad Matin, who is our regular host on the show, who sadly her janazah was today, and also friend of the station, Abdul Ghafoor, whose mother's janazah was also earlier today. So we kindly request that you please remember them both in your duas. So, as you will be aware, we cover different health information related topics every week. And last week, Leo did a great show in regards to martial arts and self-defense. Today's topic, however, is in regards to genetics and health. I'm sure our listeners are going to have thoughts on this, so why not get involved? And you can do so by calling 01582 481822, or you can text or WhatsApp us on 0777 948 1822. That number again, 0777 948 1822. So, I'm delighted to say that we've been joined today by three wonderful guests who I will ask to introduce themselves, their organisations and their relevance to today's topic regarding genetics and health. In the studio, we have Christine Rogers. Christine, could you just introduce yourself?
Good evening, everybody. My name is Christine Rogers, as Suliman has just pointed out, and my role is the Flying Start Implementation Manager for Luton. And Flying Start is it's a strategy for families, for children during pregnancy and to 5 years. So we look at the services that are available for families in Luton, and we work with a range of professionals to help make the services better for families.
Fantastic. Thank you very much for joining us this evening. And also on the phone, we should have Kerry. Kerry, can you hear me?
I can. Good evening.
Fantastic. Thanks very much for joining us, Kerry. Kerry, can you just introduce your organisation and your relation to this topic?
Yeah. So, hello everyone. My name's Kerry Leeson Beavers, and I'm the National Development Manager for a patient organisation called Alström Syndrome UK, and I'm the project lead for Breaking Down Barriers.
Fantastic. Thank you again for joining us. And we should also have Dr. Rhoda Akilapa, who I think is possibly just going to join us in a few moments on the phone. So I'll come back to the doctor shortly. So, as I say, what we'll be doing today is really expending quite a bit of time discussing not only genetics, but a very exciting project that, an event that's coming up in Luton, specifically designed for Luton parents, that we'll be discussing in detail. And I know a lot of work's gone into this, so we're really keen to kind of share the day and the details around that. So, as I say, listeners, why not get involved by calling us on 01582 481822, or you can text WhatsApp on 0777 948 1822. Great. And I believe we will now have Dr. Rhoda on the phone.
Hello, yes. It's myself, yes.
Fantastic. Thank you so much for joining us. Could
Thanks
you
for
just
having me.
explain a little bit about your role, your organisation and your relevance to the topic?
Yeah, absolutely. So I'm Dr. Rhoda Akilapa. I'm a geneticist, and I work for the Northwest Thames Regional Genetics Service. So we see patients in clinic and organise genetic testing and provide counselling and talk to families in a nutshell.
Fantastic. And we're going to come on to discuss shortly a bit more around what exactly do we mean when we say genetic testing and why is that necessary. So we will be covering all of those different areas. So we're so very grateful for having you on the line with us tonight.
That's brilliant. Pleased to be here.
Fantastic. So I can see we're already getting a few messages in. What we'll be doing is we'll be going for a adhan break very shortly. And following that, we will then pick up our questions and discuss the event in a bit more detail. So rather than get too much involved in the detail right now, I'm just going to hand over to the colleagues who will be arranging for the azan break, for the Maghrib break at 7 minutes past 6. But do stay with us, because as you will hopefully have seen from the range of guests we've got, today's topic is extremely interesting and it's varied, and we really would appreciate engagement from all of our different listeners that we have. So very much looking forward to an interesting discussion and a better understanding of genetics and why it's important to have awareness and education around this, not only if you have children yourself, or if you're a health professional, or even if you're working with families. I think this topic should be of interest to pretty much everyone across the town. So hopefully it will be. Just while I have a moment, we would also like to encourage our listeners to suggest any topics they might have for future shows. Alhamdulillah, this show, a health and fitness show, has been running for over 3 years now. Mashallah, brother Fahad Matin has done a phenomenal job at keeping the show going. But you know, we've discussed this in the house, and we were saying it would be great just to hear from listeners in terms of what they feel would be good topics for us to discuss in the future, so we can make sure that we continue to meet our listeners' needs. So you can either WhatsApp those to us, or otherwise we're going to explore different ways in which we can engage with our listeners to get some more kind of thoughts on what potential future topics we might want to look at. I know that we have Ramadan coming up, and I'm excited to share with you that we have a few different shows that will be looking at various different ways in which we can ensure that we maintain our health and well-being through the month, including topics such as healthy eating in Ramadan, stop smoking in Ramadan. We're also delighted to share that we're going to have some guests joining us from the Luton and Dunstable Hospital that will be talking in regards to fertility and pregnancy and various different topics. But we'd love to know if there are any topics you would like us to discuss, so please share that with us. And also, if there's anyone out there who works in the health and fitness world, then we'd love to have you on as a potential guest. You know, we really appreciate all of our guests giving up their time to join us, and we'd like to expand that further. So, you know, if you do have a particular interest within health and fitness, or you are a health and fitness professional, then please do get in touch with us, and we'd love to have you on. Great. Thanks very much, listeners and viewers, for staying with us. So, as I said just before the break there, today's topic is all in regards to genetics and health. We have a range of different guests, both in the studio and on the phone. So let's kind of get into the detail of why we're here. So, mentioned at the beginning there, Chris, in relation to an upcoming health awareness and genetics event, which our colleagues on the phone are also supporting. Can you just tell us a little bit more about why you're holding this event?
Certainly. We decided we would hold this event because we thought it would be a really good opportunity to actually bring professionals and families together. We were very keen to provide an event that would actually raise the profile of some of the more rarer genetic disorders, but equally for families that live in Luton, we're very keen to ensure that they are aware of organisations that are local that could actually support their needs. And so that's actually why we brought this event together, because we were looking at how it could be really helpful for professionals, but for families on the ground, looking at it from their perspective.
Sure. So it's a Luton-based event. And what other organisations are going to be there?
So we have the Sickle Cell Society, we have the Breaking Down Barriers. Kerry's bringing a few organisations along with her because we just thought that'd be really helpful. There are a lot of organisations that I have to say I hadn't heard of before, and I'm sure for many families there'll be organisations, or there may be their child's got a genetic disorder but they don't actually know which organisation they can go to. The Luton Parent Carer Forum will be there as well in attendance, and we know that they're a really pivotal part for some families. We'll have the children's centres, we'll have dental services, we will have the Disability Resource Centre. So we have actually I think we've got about 20 to 25 organisations that will actually be in attendance on the day.
Yeah, so clearly a lot of work's gone into trying to get everyone together on one day. And when is the day? When and where's the location?
Right, so we're very excited about this event because it is the first time we've ever done it, and we're very excited about the learning as well that will come from it for everybody, really. So it will be held at Luton Central Library, so it's a nice central location for families. It's on Tuesday the 26th of March, and it will be 10 till 3 p.m. And we will have organisations distributed throughout the whole of the library, but we will also have, which is really quite exciting, some free information sessions for families and for professionals. So we'll have sessions that are a parent's perspective, and we'll have some families that have worked with organisations, and we'll be looking at how they've dealt with some of the challenges that they've had and how they've linked with other services. And we'll also have the genetic services, of which Rhoda, I believe, will be in attendance.
Fantastic.
Yeah.
And hi, Rhoda, do you want to come in there?
No, that's absolutely fine. Sorry, carry
Fantastic. No problem. We look forward to welcoming you to Luton. So just to be really clear then, Chris, in terms of the target audience for this event, it's very much for parents?
It's very much for parents. So it's for parents with children of any age, really. So we're looking at linking everybody up so as people can come into the library and they can meet organisations, but also for professionals as well to come along and learn about the family's perspective. We're really keen to get that side of it as well.
Yeah, absolutely. Because it sounds as though for anyone that might be working with any families, it would be beneficial to have some knowledge in terms of what services are being made available locally.
Absolutely. And I think that many professionals on the ground find it helpful to attend events where they actually get to talk to people, to actually understand what an organisation can offer, in the same way a family might not be aware of what's actually out there. For professionals as well, to actually then signpost and to let parents know what support's available. We see this as being a really exciting element of this event.
Fantastic. And is there information available on your website for people? Yeah. So what's the website?
So the website is the Flying Start website, which is, shall I give you the link to it?
Yeah, go for it.
It's www.flyingstartluton.com, all lowercase.
Fantastic. That's great. So people can find more information on there and share that link as well. That's really useful. Kerry, I just want to bring you in terms of, at the beginning, at the intros there, you mentioned the Breaking Down Barriers program. What is the Breaking Down Barriers program?
Okay. Well, Breaking Down Barriers is a project that's funded by the Sylvia Adams Charitable Trust, but it's managed by our organisation, Alström Syndrome UK. So just to give you a little bit of background, so I'm also the parent of a child with a rare genetic condition. So my son is diagnosed with Alström Syndrome. And actually there's only 82 cases of Alström Syndrome in the UK. So I do have some understanding of the experiences of families and what they go through being diagnosed with a genetic condition. So I joined Alström Syndrome UK around 15 years ago, and I work for the organisation full time. So back a number of years ago, we looked at our database and we realised that we only had 3 children on our database from ethnic minority communities. And we knew that with autosomal recessive conditions that Rhoda will explain a little bit more about later on, that we did feel that there should be more children from ethnic minority communities that may be diagnosed with Alström syndrome, but for some reason they weren't accessing our service, or maybe they didn't even have a diagnosis. So we developed a project that was funded by Sylvia Adams Charitable Trust to try and raise awareness of genetic conditions and improve our engagement with families. And we're really pleased that was a very successful project. So then Sylvia Adams Charitable Trust came back to us and said, actually, we'd like to fund more work in this area because we can really see the impact that you've had with being such a small organisation. So this is where we developed Breaking Down Barriers. So the aim of Breaking Down Barriers really is to support patient organisations, support groups and community networks to develop supportive and inclusive services for people from ethnic minority communities. So we want to make sure that we can do our very best to make sure that families affected by genetic conditions can have access to information that's accessible so that they understand more about the condition and how to manage that condition. And one of the real key things for me is that families receive the information that they need to be able to make an informed choice about future family planning, because families can't really make those important decisions unless they really understand about their condition and what their options are. And genetics obviously is very complicated, and it's very difficult for families to understand that. So we work with organisations to try and provide that information in an accessible format. So how do we do it? So we recently expanded our project, and we're now working with over 30 different organisations, and there are a range of organisations from very rare conditions to some of the more common conditions, and community groups as well. So we provide grants so that each organisation can develop their own individual project. And we also provide an annual workshop where we invite speakers to educate groups on things like cultural awareness and new developments in genetic services, because there's a lot happening in the UK at the minute with genetics. But we also share knowledge and experiences as groups so that we can learn from one another. And I think one of the things I'm very passionate about, obviously being from a patient organisation and understanding it from a parent's perspective, is that patient organisations can often provide that link between the families at home and the health providers. So we want to make sure that we're doing all that we can to support those organisations to develop the skills and resources that they need to make sure that families really do receive the best support and information available. But I think the reason we're now involved in the Luton area is one of the other area that we're working on is developing partnerships with representatives from different local authorities and health services so that we can support those organisations. We can help organise events to raise awareness of genetic conditions, but also to look at if there are any gaps in service provision and how we might be able to support that and make sure that patients and their families have a voice in how services are delivered and making sure that they're as accessible as possible.
Fantastic. I mean, it sounds very detailed. Like you said, it's quite a complex subject area. But, I think it's fair to say we really appreciate you coming to Luton and trying to, support and coordinate some of the work that's happening here. So hopefully we can all work together with you on that. So really appreciate you doing so. So I'm just conscious we're coming to an advert break in a few moments' time, but one of the words you used was recessive disorders. And Dr. Rhoda, I'd just like to bring you in. You might need to finish it after the break, but in terms of what exactly is a recessive disorder?
Yeah, definitely. So when we talk about recessive disorders, I think we probably have to start by talking about genes. So if we think that our genes are the instructions to how our bodies grow and develop, so we'll have genes for things like eye colour and hair colour, but we also have genes for the way our brains and our organs develop as well. And if you have a problem in one of those genes, it can sometimes lead to a genetic disorder. But one of the ways that our bodies have kind of evolved is that our genes come in pairs, because we inherit one gene from our mum and then we inherit another copy of our genes from our dad. And a problem in one of the genes often doesn't cause a problem because you've got the second normal copy that acts as a backup. But if you've actually got a spelling mistake in both copies of that gene, that's when that child is born with the disorder. And so you'd expect to see mum and dad not having health problems because they would have one affected copy of the gene and one working normal copy. And one working normal copy is really all they need. But if chance, Dad has passed on the faulty copy of the gene to the child, and Mum has also passed on the faulty copy of the gene to the child. And we see a recessive disorder show itself. And that's what we sort of typically see in families where Mum and Dad are absolutely healthy, and it's as if this condition's just sort of come out of the blue because parents are carriers and the child has inherited the two faulty copies of the gene.
I see. So there was the other thing that was mentioned is in regards to, well, actually, just before I get onto that, I mean, just in terms of, so you mentioned there in terms of you get one from your mother and one from your father, and then that's how that kind of marries up. In relation to what potentially increased risk factors could there be for families in relation to recessive disorders? Can you just touch on that?
Yeah, definitely. So again, thinking about the fact that we're all made up of genes, the genes being the instructions to how we grow and develop. The spelling mistakes within the genes is not something that is uncommon. So any human being has about 20,000 genes, and the average healthy person walking around will have at least 100 spelling mistakes scattered around, which wouldn't be causing any problems. But if you happen to come together with a partner who has a spelling mistake on the same gene, that's when a recessive disorder might arise. Now, if you marry a relative, you're more likely to share DNA. So, for instance, first cousins share about 12.5% of their DNA.
Okay.
So you're just more likely to have spelling mistakes within the same genes if you do marry a relative. Now, a couple who are not related at all, if they come to clinic and ask me what's the chance of us having a child with a genetic disorder, any genetic disorder, I would say it's about 2%. But if
Okay, Dr. Rhoda, I'm just going to have to cut you off there because we're just going to go to the advert break. But what we will do, we'll pick that up again just after these short adverts. So please do stay with us.
Yeah, we'll do.
Assalamu alaikum, this is Atif Nawaz. Listen to Inspire FM shows in your time by heading over to inspirefm.org or listen on Apple Podcasts or Spotify.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Welcome and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. I'm your host for this evening, Suliman Rafiq, and today's topic is in relation to genetics and health. I'm just going to ask our guests to reintroduce themselves for anyone that may have missed the introduction. Kerry, can I start with you?
Suliman Beavers, National Development Manager for Alström Syndrome UK and the project lead for Breaking Down Barriers.
Great. And Dr. Rhoda?
Hi, I'm Rhoda Akilapa. I'm one of the genetics doctors who's based at Northwest Thames Regional Genetics Service at Northwick Park Hospital.
Great. And finally, Chris?
Hi, I'm Christine Rogers and I'm the Flying Start Implementation Manager and I work with a range of partners, and Flying Start are always quite integral to most things that go on for families with children 0 to 5, and so we're very much part of this programme.
Thank you. And just to remind viewers that this broadcast is coming live today on Thursday, the 14th of March, 2019 from the studios of Inspire FM. So good evening. Welcome back, everyone. So just before the break there, sorry, Dr. Rhoda, we had to cut you off to get to our adverts. You were just explaining a little bit more around some of the increased risks for families in regards to genetic disorders. Could you just pick up on where you were?
Yeah, certainly. So I was talking a little bit about the risk of genetic disorders generally, and then you can kind of compare that then to the risk of if you're married to a relative. So for a couple who comes to a genetic clinic that are planning to, say, have a baby, the risk of having a child with any genetic disorder is about 1 to 2%. Now, if we see a couple who's married to a first cousin, that risk would increase to about 3 to 5% usually. So it is a kind of a bit more than a doubling of a risk. It's not a huge increase. There's still a 95 to 97% chance that that person will not have a child with a problem, but it is an increased risk.
Sure.
And I was talking a bit about the reason behind that being that if you're related to a person, you share in your blood, you do share a proportion of DNA. So the more closely related you are, the more genes that you share, and the more genes that you share, the more likely you are to have spelling mistakes in the same genes. And those recessive conditions arise when you get when the child inherits 2 copies of a gene that have the spelling mistake on them. Now, that increase, that sort of 1 to 2% going up to 3 to 5%, only applies for a couple who don't have a family history of genetic disorders. So that's important to remember.
Right.
I think if you actually have children in the family who are born with significant illnesses or disabilities, then that's a different situation. And then it would be helpful to see genetics to talk about the risk that's specific to that couple.
Sure. And is there any additional risk in regards to, so you mentioned in terms of with cousin marriages, but if your parents had cousin marriage, then does that increase the risk, or it doesn't all work like that?
Yeah, it can, yeah. So as I mentioned, the sort of generic risk is the sort of 1 to 2%. And then if you're first cousins, we say that the risk doubles. But obviously, double 1 to 2% is 2 to 4. But we would normally say 3 to 5 because of the fact that, as I said, the more closely related you are, the higher the sharing of DNA. So when we see a couple who are first cousins, like you say, they're often not the first people in the family who have married first cousins. Parents might also be first cousins as well. We might see a couple who are double first cousins. So say, for instance, your sisters, your mothers are sisters, but also fathers are brothers as well.
Right.
That would be sort of double first cousins. So that sharing of DNA that we would calculate to be 12.5% between first cousins. Actually, when you look at more ancestral marrying within the family, that percentage is often higher. And so studies that have been done in some communities within the UK, the risk is higher than, even sometimes higher than the 5%. We can get up to sort of 7% in some communities. So yeah, the more related you are, the higher the risk is.
Sure. That's really helpful. I mean, you've explained that in quite a simple way, given this is quite a complex topic. Just can I just ask, in terms of, from your perspective, you're obviously heavily involved in this. Can you just explain, in terms of, you mentioned their genetic testing. I mean, how does someone get genetic testing? Who is it available to? Can you just explain that process in a bit more detail?
Yeah, definitely. So I'd say that genetic testing is quite a broad term that describes the process of looking at the genes. The key thing to think about for somebody who's wanting to get information.
So it appears as though we've lost you on the line there, unfortunately. We will try and... oh, sorry. Are you back?
Yes, I think so. Can you hear me?
I can now, yes. So go ahead.
Okay. I'll try and stay very still.
Please do.
So what I was saying is the first stage is really gathering as much information as possible from the family. And then in terms of being seen by genetics, I think if you're in a situation where there are children in the family who have significant problems or have a genetic problem, then the first thing would really be to go to the GP and get a referral to be seen in genetics clinic. And then that sort of can get the ball rolling to see whether genetic testing is appropriate. So it's not always appropriate to go ahead and do a test straight away. It is quite complex and it requires a lot of information gathering so that we choose the right test for the right person.
Sure. So in terms of if someone is listening to this that would is concerned perhaps, then the first step would be to speak to their GP. Is that right?
I would say so, yes. So if, for instance, a person has a child who has an illness who's already a doctor in the hospital, then that could be an avenue to talk to the doctor in the hospital and say, you would like to be referred to genetics. So we get a lot of our referrals from pediatricians, from neurologists, but also if you're somebody who is planning to start a family or thinking about starting a family in the near future, and there are people of possible genetic disorders within the family, then you could just go to your GP and say, look, we're thinking of starting a family soon, and this is our family history. Please, can you refer us to genetics? And then we can sort of talk through things and see what genetic tests we could offer to that couple.
Fantastic. And just we just had a question in from a listener, so thank you very much for your questions. The question is in regards to, is the risk specifically for first cousins, or does it apply to second, third family relations also?
So, yeah, that's a good question. So the risk does increase slightly the more related you are. So as I said, the amount of DNA that first cousins share is roughly about that 12.5%. When you get to second cousins, it's about just over 3%. So it does go down quite dramatically the further you go out. So the risk is a lot lower for second cousins, but overall, when the risk for unrelated couples is risk for first cousins, as I say, is about 3 to 5%. These are families where there is no family history already of genetic disorder. So if you are married to your second cousin, there is risk there still for married to first cousin.
Sure.
But as I say, we have to remember that if you're not the first cousin marriage or second cousin marriage in the family, you might be a bit more related than you think, if you see what I mean.
I do, yeah. So it's best to, if you are in that situation, then seek some opinion from a health professional. Is that fair to say? Yeah, fantastic. Yeah. Just moving on in terms of, we've obviously got this really interesting event coming up for Luton families. So just in relation to families that may have a child with a health condition or a special educational need, Chris, is this event going to have anything particularly catered for them?
Yes, most definitely. This event is designed to be an information session for families. It's also designed to look at the library. We're hosting it in the library for a number of reasons. It's very central, but equally the library are keen to look at even literature and books and things that might be available for families to support them. The idea of having the genetic service and having the array of different organisations attending the event is so as families can access the information. They can talk to people. We know that actually talking to people is usually the easiest way and the most comfortable way of having an understanding perhaps about an organisation and what they can offer. And having the parent-carer forum there as well is great, because actually that enables families to have conversations with some of those people that have actually, families that have been through it, and actually there's nothing quite like talking to somebody that's actually been on the journey themselves. And so that's why we're very keen that the parent's perspective comes across as one of our information sessions. So sharing the information that Rhoda's been talking about in a very easy to understand way is very helpful for families, I'm sure. But equally, I think understanding that there are people out there that have been through what you've been through in the same way that Kerry talked about, actually I think that's really, really helpful. And that's what this event is designed to do. It's designed to make it as supportive as it can, really, for families to find information, but equally to know where they can go for onward support.
Fantastic. And just for people that may have joined us a little bit later, can you just recap in terms of the details of the event?
Most certainly. It is a free event, which is always good to know. It's held at the library. It's on Tuesday, the 26th of March from 10 till 3 o'clock. There will be organisations throughout the library, so you'll wend your way through the library and you'll access all of the organisations, and the upstairs in the library will have the information sessions.
Fantastic. And Kerry, you're going to be there, and you're bringing some organisations with you, or which organisation are you aware of?
Yeah, so we'll be bringing along information about from a range of different organisations. So there'll be some joining us there. There'll be the AKU Society, there'll be Sickle Cell Society, Beadle Syndrome. Obviously, I'll be there sharing information about Alström syndrome as well as breaking down barriers. And then even for the organisations that can't be in attendance, I'll have quite a lot of information on our stand available for families as well. And we'll be there to talk to families.
Fantastic. Now, it sounds like a really great opportunity for everyone to come down and learn a little bit more about this topic. I really hope that listeners will engage with this important event. And as we say, not just necessarily if you have children, but also if you're working with families or you're a health professional that would just like to understand these topics in a little bit more detail. It's a really great opportunity. And I just want to thank our three guests in terms of, the effort that they're putting in to make sure that families in Luton are being able to access, these various different services that are available to us, free of charge. So really appreciate all your hard work that you're doing. Just moving the conversation on a little bit in terms of Chris, you obviously representing Flying Start, and I appreciate they do a lot within Luton. Can you just touch on other things that are available for families at the moment through the Flying Start program?
Yes, most certainly. If we were sticking to the topic that we're talking at the moment, before I move on to some of the other services, we do currently have workshops that are available for families, or for parents particularly, that have got children under 7. The criteria for attending is that your child must be on the waiting list for the Edwin Lobo Centre or recently been seen. And we have topics ranging from managing your child's behaviour, helping your child to sleep, difficulties with senses in everyday life, talking and playing with your child in the family and community, and being the parent of a child with additional needs. And these workshops are designed to give you ways to manage the situation that you're perhaps potentially struggling with at home, and ways to look at how you can make life easier for yourselves. If you would like to attend one of these workshops, we are keeping a waiting list now, and if you could ring us on 01582 548 335, we could put you on a waiting list.
Fantastic. Is there any cost for those?
No, they are free workshops, and they're designed to support families, because we know how difficult it can be.
Absolutely.
Particularly if you're waiting to have a conversation with professionals, then actually it's a nice opportunity to actually start to make some changes perhaps at home that might make life a little bit easier for you.
Fantastic. That sounds really interesting. Just before you do move on, and on a perhaps a slightly lighter note, I can't ignore our listeners. We've had a few questions in. Dr. Rhoda, I hope you don't mind, just in relation to questions around genetics, and particularly asking around the concept of a fat gene. Is that something that is an urban myth, or is that true?
There are genes that cause genetic disorders that can predispose somebody to being overweight, yes. But there isn't a single fat gene at all, no. So as I said, there are 20,000 different genes, and we do know of genes that can contribute to being overweight. So there is some genetic element to it, but there is still, of course, a huge environmental component as well. So I think, just being overweight by health, I can't think of a single gene for just that, no.
Sure. So it's very much related to your kind of what you're eating and your physical activity levels as well.
Combination. So general obesity in the society, I think there's a big environmental component. But yes, I think there is some genetic influence as well.
Sure.
Yeah, so it's likely to be a combination of genes and environment.
There you go. So, listeners, thank you very much for a few of you that put forward that question. You know who you are. And just, Kerry, can I just bring you in again, just in terms of, obviously, you're looking to expand your work in Luton. Is there any other kind of key messages you'd like to share with us?
No, I think it's just making sure that families know that there are patient organisations and support groups out there that can help too. And sometimes it can be quite daunting to contact health professionals, particularly if you're not sure, if you've got some symptoms and you may have done some research yourself and thought there may be signs of a particular condition. There are patient organisations and support groups out there that will be more than happy to take a call and have a conversation about that as well. That's often now we get people referred to our organisation. So for Alström syndrome, for instance, we have children that have got a severe visual impairment, they're overweight, they may develop heart problems. And sometimes linking those symptoms together, parents often go onto the internet and may suspect it's a condition. So we'll often get calls from parents, and then we can support them and refer them into different services to be able to get the tests that they need.
Sure. No, that's really helpful. So just to be clear there, then, if that is something that parents who are listening are going through at the moment in terms of looking online, etc., the thing to do is really to get in touch with one of these relevant support groups. Is that, if I understood that correctly?
Yeah, and obviously to speak to GPs as well, and it's not to replace the health service, but if they feel they want some support to do that, then that's another avenue to go down.
Yeah, no, I think one thing that's really come out of today's conversation is about that supportive kind of ethos around that. It's not, you're not necessarily alone in what you're going through, and that there's various different organisations to support everyone in the community. So that's been really one of the highlights for me. Sorry, Chris, back to Flying Start. I know there's so much that goes on at Flying Start. Can you just share a little bit more that you've got coming up at the moment, or that's live?
Right. Well, Flying Start, we would hope that most families in Luton have seen Flying Start in some form. We have our Flying Start Children's Centres, which are across the whole of Luton, and they offer a range of services from when you're expecting a baby through the antenatal period. We've got programmes for when you've had your baby, so the child health clinics for if you want to go and weigh your baby will be held at the Children's Centre. But we also have lots of groups that are designed to get you out of the house. If you want to meet other families, you want your child to mix with other children, and you want to perhaps just get out and make friends, then the Children's Centre is a really good place. We also have on offer a range of programmes for parents as well to look at how they can have some additional support if they're struggling a little bit. So we have a range of different programmes that are available for families. We try to have something that meets most of the needs. And the staff in the Children's Centre, if you have any worries or any concerns, then they're another good contact really to go into your Children's Centre and just talk to them really about issues and things that you're finding challenging, because they will be able to identify what's the best service for you, and we're always keen to do that, make life as easy as we can for families when they have children, because we know children don't come with a manual, and we know it's not easy. We've all struggled at times in our lives, and actually the fact that we've got children's centres available for you locally, and I think we just have to make sure that we all use them.
Absolutely. And it was interesting because my understanding is that 0 to 5 age is so critical in a child, in a person's development. It really sets them up for the rest of their life. And one of the points you made there was around interacting with other children. I know homeschooling now is becoming more and more common, throughout the country. And so this is a good opportunity for 0 to 5-year-olds to engage with other children and learn those kind of skills, I guess.
Yes, yeah, absolutely. I mean, we know that children's brains develop more when they're born than actually at any other time in their life. We in Flying Start have a really nice programme called 5 to Thrive, which we encourage everybody to follow really. It's in the same way that you were introduced to 5 a day with your fruit and vegetables. Right. We have 5 to Thrive, which is around supporting your child's brain development. So this can be even when your baby is still inside your tummy. So actually the importance of talking to your unborn, because we know that at about 24 weeks, I think it is, actually babies can hear, and so they will be responding, they will be listening. So it's really important, even at that very, very early stage, to start to talk to your baby. But our 5 key messages that we're really keen to make sure that all families know about are talking, playing, relaxing, cuddling, and responding. So if we did this every day with our child, we would know that actually we would be helping their brain development. It's really important to do these things in the very, very early stages of a child's life. We know we all want the best for our child. We all want them to do really well when they get to school. And what we do when we're a parent, when we've got our child at home with us before we even get to the school stage, is so important. So these are the 5 key messages that we're really keen to get all parents to know that Fantastic. They should be doing.
And by responding when by their cues? What do you mean by
Yes,
responding?
absolutely. So if we were going to take, for example, a child that was, we know babies will look at you, they'll make noises, and they are trying to interact with you. Babies look at faces. It's something that's really important to a baby, that the face, they're really keen. It's something that they're attracted to. It's an innate part of their development. And so when you respond to your baby, when you talk back to it, when you talk in infant-directed language, I know we all do it, where you go, oh, what lovely you are. We all change the pitch of the tone that we're using with the baby. It's really important. That we call that serve and return, and that's so important to the baby's brain development, because actually all of the neural pathways, it's joining up all the dots in the baby's brain, and then that baby feels that they're loved. So when we talk about cuddle, the importance of skin-to-skin contact is so important, particularly in a newborn baby. When we talk about relaxing, it's about making sure that we have time to sit down. It's really important to take time to sit down and just chill and actually be in the moment with your child and playing and talking. So there are 5 key messages.
Fantastic. No, that's really interesting. I think often sometimes we just forget how important the fundamentals are, you know, and just taking that time to do some of the things that you've just mentioned can really make a positive impact. The other thing I've heard quite a bit about is me time family. Can you touch a little bit more on that?
Yes, absolutely. So going back to the fat gene that we've just discussed, ways to mitigate, ways to help us, our environment, are actually being active. Yep. So we work in Flying Start really closely with Active Luton, and we have a programme called Me Time Family. It's designed for families with children under 5, and we have a range of different activities that Active Luton will offer. So it's available across Luton in a lot of the community centres that they hold things in, and their sports centres. But there's a Go for Less card, so you'll be able to access 10 sessions for you and your family for £10. And you'll then be able to access things like mini nastics. There's a little footballing activity. There's something new coming in called Zumbini, which is very exciting. Zumbini, yes, very exciting. So there's a range of activities. It's really good to get out there, to get physically fit and get active. And that moves us seamlessly on to the topic for Picnic in the Park this year, which will be the 26th of June. It's held in Wardown Park, and we are looking at being active as our topic for that. So it's about thinking active and being active. That being active every day helps you off the healthy way. So we're really keen to see as many families turn up for Picnic in the Park on the 26th of June. Come along, enjoy the activities. There's lots and lots of free activities for families.
Fantastic. Picnic in the Park. So everyone's going to be walking down to Picnic in the Park. Yeah, that's great. I'm sure Leo, one of our fellow co-hosts, will be delighted to hear that, because we're all huge advocates of physical activity. Just a comment here from a listener, just to say thank you to all the staff at their local children's centre, Dallow, for all the work that they're doing. She feels really supported there. So just passing on that message. Thank you very much for messaging that in. We've got only 45 seconds left. Kerry, Rhoda, are there any last points that you'd like to make before we finish for today?
I just look forward to seeing everybody at the library on the 26th.
Fantastic. 26th of March at Luton. Great. Thank you very much, Rhoda.
Yeah,
and
that'll be good.
Finally, Chris?
Yes, I'm really looking forward to the event. It's been great working with Kerry and also Rhoda, and we're looking forward to seeing as many families as we can there. It'd be fantastic to see you all.
Many thanks to our listeners. If you've missed any of today's show, you can catch it up on the Inspire FM website or Facebook. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you for listening to our podcast. Why not tune in to our live stream at inspirefm.org and follow and subscribe to our social media platforms at Inspire FM Luton.